Hi, good morning everyone. This is Mrs. Rajalakshmi Murthy. Today the topic which we are going to discuss about hypovolemia. The condition already you have known very well. The introduction topic I have discussed these things. With this condition we will be discussing detailing in this video. First, let's clear the title first. Hypovolemia means hypo. Hypo means decrease. Volume means volume. Mia means blood. Decreasing blood volume. That condition we can call it as hypovolemia. Okay, it's a one type of fluid volume disturbances. In that, a lot of conditions are there. So this video will be discussing about hypovolemia. Okay, when the person is having hypovolemia, so that the time their blood vessels having look like this only. This is a healthy one. This is a decreasing blood volume status. Okay, so before going to the topic, we'll see about the functions of water in the body. I already the introduction video I have uploaded all the things. So without fluids and electrolyte balance, our body will not function properly. For each and every organ to function properly, we need the proper fluids and electrolytes balance. So in fact, in our body is made up of 60 to 70% of water. So we have to take more water based on the fluids and the electrolytes. Our body organs will be function properly. For example, here the brain is consuming 90% of water to function properly. Not only the brain, for heart, lungs, then GI system for transporting the food materials, digestion, to function all the things for muscle, bone, everything we need a fluid balance to function our body properly. Okay, so it's a hypovolemic condition. It's one type of fluid volume disturbance as a topic which is coming under the fluids and electrolyte balance. Okay. So first we'll see the what is meant by hypovolemia. Hypovolemia means there is a fluid volume deficit occurs when loss of extracellular fluid volume exceeds. In introduction video I have said there is a intracellular volume, extracellular volume. Here the fluid volume is lost from extracellular space. Clear? That condition we can call it as hypovolemia. That is hypovolemia means low blood volume. The next one is dehydration. Dehydration means loss of water. This condition, diarrhea and all, we can say the dehydration. Then untreated hypovolemia leads to shock. If we are not supposed to treat this hypovolemic condition, it leads to shock. They can go for shock. Then severe hypovolemia may lead to hypovolemic shock. Okay, clear this? So what is the cause for this hypovolemia? The first one cause is external injury, blood loss from external injury. If suppose if the person met accident, so during that time if left untreated, so it may cause injury, internal or external. It leads to hypovolemic condition. Then persistent or severe diarrhea or vomiting. Diarrhea, you all know very well. The stool is passing often, so that condition we can call it as diarrhea. Then extensive burns. Burns also, the fluid is losing more. Then excessive sweating. Osmotic diuresis. Osmotic diuresis means it's a one type of condition. Usually the kidney is filtering all the fluids and electrolytes, the waste materials, toxic, all the things. The certain type of fluids will not filtering the kidney, so that time lot of fluid volume is lost through the urine. So that condition we can call it as osmotic diuresis. And then diabetes insipidus, it's a one type of complication of diabetes mellitus. For this condition is also the lot of fluid is getting lost. Then adrenal insufficiency. In that adrenal gland there is a hormone which is secreting from the adrenal gland, that is aldosterone and cortisol. So this hormone will be maintaining the electrolyte balance. If it is not secreting properly, so there will be the insufficiency of fluid. Then intestinal obstruction. Intestinal obstruction in GI system, the fluid is circulating nearly 8 liters of fluids is circulating in this GI system. If any intestinal obstructions are there, the fluid and electrolyte balance are disturbing here. then it will lead to hypovolemic condition. Then hemorrhage, that is a blood loss, we can call it as hemorrhage. Then decreased fluid intake. Decreased means the water intake, the person itself they are taking a very small amount, so that condition it go for dehydration. Then third space fluid shift. Okay, what is meant with third space fluid shift? Ma'am, you have said the intracellular space and extracellular space. What is the third space fluid shift? So it means the fluid is shifting. Not the fluid is usually the fluid is shifting from intracellular to extracellular and circulating all over the body. But apart from this, the third space fluid shift means the fluid mobilization, that is body fluid, is shifting non-circulatory space. It is not circulating in the circulatory system. That fluid we can call it as third space fluid shift. Okay. Next one is, what is the symptoms? What is the signs and symptoms? That is nausea. Nausea, you know very well. Then dizziness. Nausea means that is vomiting sensation. That condition we can call it as nausea. Dizziness means ऐसा चक्कर आएगा बोलेगा ना, giddiness. So that we can call it as dizziness. Headache. Then profuse sweating. Sweating is more than fatigue. So these conditions is the signs and symptoms of hypovolemia. Then signs and symptoms, each and every system will be see. First one is the cardiovascular system. The first one is hypotension. The blood pressure level will be decreasing in the hypovolemic condition. Then peripheral pulse also decreasing, increased heart rate. Then dysarrhythmia means there is some changes in the ECG. Tachycardia, that is the increased heart rate, increased central venous pressure. So this is and all symptoms of cardiovascular system. The next one is respiratory. In respiratory, dyspnea means difficulty in breathing. Then respiratory rate also increased. Next one is neuromuscular. In that, skeletal muscles are will get to weakness. If we are not untreating, it will go for lethargy to coma, then fever. Then renal system, obviously the urine output is less because already the patient is in hypovolemic condition, so the urine output is obviously it's decreased. Then integumentary, that is the skin. How we know the person is having dehydrations, that is a poor turgor. Here see this image. When we are pinching the skin has to go back to the normal condition, but here it is not going back. So this type of skin, if you are seeing, the person might have the dehydration. Okay. Then dry skin or pale skin, dry mouth. The mouth and oral mucosa, it's getting very dry. Next one is GI system. GI system, thirst is increasing. Because of dehydration, the person may feel very thirst. Then diminished bowel sounds. Bowel sounds are decreased. Then the bowel movement also decreased. It leads to constipation. Then decreased weight loss. So how we can find this hypovolemic condition? Not only the single symptoms or diagnostic test, they are not diagnosing this, that is the person is having hypovolemic. Based on all the signs and symptoms and blood reports, um, they will diagnosing the person is having the hypovolemic condition. So what are the symptoms? It depends upon the patient. Vary. So some patients have more symptoms in GI, some patients have more symptoms in skin. So it depends upon the same signs and symptoms. They will diagnose it. Not only the along with the signs and symptoms, along with the blood reports, they will do the findings. Okay. Here laboratory findings, there is elevated potassium serum lactate blood urea nitrogen level. This is a blood report. In that blood report, potassium and blood urea nitrogen level, this and all increased. Then urine, that is specific gravity urine osmolality, this is also increased. In urine test, if you are going to hospital, you please go through the case sheet. If the patient is having hypovolemia, you please check the urine test diagnostic report. In that they have mentioned the specific gravity and the osmolarity. So what is the value? Then you will get to know they think the patient is having hypovolemic. Then blood consideration. In blood, they will see the blood pH, oxygen level, then carbon dioxide, everything they will see. Okay, next please. So how we can prevent this hypovolemic condition? Suppose if we know the patient is having dehydration, if it is left untreated, it will go for hypovolemic shock. So we have to treat in dehydration period itself. So that one is we can call it as early reduction. Recognize the patient with condition that reduce the blood volume as risky patient. Suppose the patient is having mild dehydration, in that period itself we have to correct it. How we can correct? By fluid administration, intake of oral fluids, that things. Then accurate intake and output chart we should maintain for this type of patient to prevent hypovolemic shock. Next one is medical management. How we can manage in emergency situation? That is, the first one is oxygen administration. The second one is intravenous administration to replace the loss of fluid. Suppose if the patient made some accident or some injury, or a patient has severely dehydrated, so that conditions we have to do in emergency situation. First do administer oxygen administration and IV fluids. It depends upon the physician order. Next one is medication. The patient is having the diagnosed as a diarrhea. So antidiarrheal drug we have to administer antiemetic, antimicrobial, then antipyretic. Based on the disease condition, we have to administer the drugs. The next one is fluid replacement. What type of fluid? So I in the introduction video I have explained about hypertonic solution, hypotonic solution, and isotonic solution. Based on this solution, that time I have said why we have to study these type of solutions. So when the patient is having this type of disease conditions, the doctor is supposed to prescribe based on their disease condition. So based on this type of fluid loss, which type of fluid loss, based on that they will prescribe the administration of fluids. Okay. The next part is our part, that is the nursing management. So the nurse, what they will do for a hypovolemic condition, for a fluid volume deficit, that conditions about what the nurse will do, she or he will do. So the first one is the vital signs. Then the second one is she need to careful monitorization of intake and output chart. Then skin turgor, how to check capillary refill. You know how to check the capillary refill. Pinching the nail buds, it will be filled within the second. So that is a normal one. Then mental status, whether the patient is confused or oriented. So like that we have to check. Then hemodynamic status. Whether hemodynamic status, the patient is stable or not, they are orientated or not. So everything we have to check. Hemodynamically the patient are stable or not, that we have to check. Then monitor weight, safe administration of blood if they require. Okay. Next one is medical management in the emergency situation. Okay. This is coming under the emergency treatment. Measures must include prompt and adequate fluid and blood replacement to restore the intramuscular volume and raise the blood pressure. Suppose if the patient met some RTA, that is a road traffic accident, there if there is any external injury or internal injury, how to control. So that is a thing it is displaying here. First one is volume expansion. We have to expand the fluid volume. Either it may be oral or plasma protein content. It depends upon the physician order. Then pneumatic anti-shock garment. This dress will be wear for the patient. In the next slide, I will show you. This is the anti-shock garments. It is counteract the it is work against bleeding. Okay, counteract bleeding and hypovolemia by slowing or stopping arterial blood. If you are wearing this type of dress, it acts against the bleeding. It will control the bleeding. Okay, by forcing any available blood from the lower body to the brain. This anti-shock garment, it is compressing the body part and flowing the blood from all over the body, especially to circulate brain, heart, and other vital organs, and thereby preventing return of available circulating blood volume to the leg. So, if the person is wearing this type of anti-shock garments, it will compress the body and it's circulating the blood all over the body places, especially brain, heart, and other vital organs. Okay, it's preventing stagnation of blood in the one place, especially in the lower body part. Okay, then treat underlying causes. Based on the causes, if the patient is having a diarrhea or excessive bleeding, so we have to arrest the bleeding the first. The diarrhea means we have to administer antidiarrheal drugs. So that is a treat underlying causes. Okay, then redistribution of fluids. We have to positioning the patient properly. That is modified Tredelenburg position. It's recommended for hypovolemic shock. Tredelenburg position means the head has to be completely um, low and foot end has to be elevated high. So modified Tredelenburg position means the lower the foot end has to be elevated, the head end has to be in flattened position. I will show the image also. Next one is anti-shock garment. The anti-shock garment will be look like this only if the person is wearing this one. If the person is having any hypovolemic shock, external bleeding or internal bleeding, whatever it may be, if you are wearing this dress, if the person is dressed by this dress, anti-garment shock, so the blood will be circulating all over the body like this. Here the blood is not supplying properly in the brain. It is most of the blood is in the lower part of the body. When the anti-shock garment, if they won't, um, the blood is circulating all over the body, especially brain, heart, and all the vital organs. Clear? So that is the purpose of anti-garment shock dress. So up to this, in this video, we have seen about what is meant by hypovolemic shock, what is the causes and signs and symptoms, how we can find out, then what is the treatment for that hypovolemic shock, then what is the medical management, everything we have seen. Then the complication, if the hypovolemic shock is left untreated, so what will be the complication? It leads to acute respiratory distress syndrome. If they are not treating properly, they can go for acute respiratory distress syndrome. So in these conditions, the fluid is shifting to the alveoli, tiny alveoli, so there is no gas exchange taking place. Okay, for this condition. Then acute tubular necrosis means your kidney tubular and all getting necrosed. That is a it's for necrosis means that is a dead tissue. uh, the kidney will not filter the fluid properly. It leads to acute kidney failure. Then disseminated intravascular coagulation, multiple organ dysfunction syndromes. So these are all complication for hypovolemic condition. Clear? Up to this, if you have any doubt, any queries, put it in the comment box. Then read smartly, learn smartly, don't hard to study. Okay, uh, be like a smartness. Okay, thank you.